emotionally. Feels like I'm sinking, never to rise no more. Father, yesterday, today, forever. You never change, you never change, you never rearrange.
Continues to have a discussion with clinical psychologist Kelly McFarlane to get a perspective on this very disturbing situation, this tragic situation where it appears that a mother would have poisoned her own 9-month-old baby and the circumstances that could have led to that. Ms. McFarlane, thanks very much for taking our invitation at short notice to be part of our brief dialogue. And I know we're just, responding to something that requires a broader, longer, more intense discussion. But when you see a situation like this, what comes to your mind as a clinical psychologist? Good morning to you.
Good morning. What comes to my mind is the level of distress that parent was in, and not only the level of distress, but the lack of coping, maybe lack of social support, the lack of information. Clearly, we don't really know a lot around what happened. If, there might have been something intellectual going on, something mood related or mental health related. We're not 100% sure. But of course, as a psychologist, I do look at what were the social factors around what happened, even around getting pregnant and having that baby, and whether there was any type of, maybe postpartum depression, psychosis, anything happening there. But, I don't know.
Exactly. We don't know a lot, but we live in an environment where everybody has an opinion. And especially with social media, there'll be all sorts of pronouncements about this, that, and the other. Much of it uninformed, including from us in the media, it has to be said in many cases. But when something like this happens, and you look at possibly the economic circumstances, the social circumstances, the level of education, because the thing is, Ms. McFarlane, how do we deal with circumstances like this to prevent them from happening, which is what I'm trying to get at? Is it about putting greater emphasis on mental health, mental well-being, recognizing the signs that could be interrupted or intercepted before a tragedy like this unfolds?
Certainly, and I'm always an advocate for getting more and more information out there. And happily, this is something that Morning Edition does. You guys always keep sort of on the helm of, hey, get the information out there. But let's take it on different levels. Let's say on the family level, someone gets pregnant. Let's get the family or the family members knowing that this is possible, that people, because of different hormonal changes and stresses, lack of sleep, all sorts of things could happen that could make the first couple days to weeks to months to even a year of having a new child very, very stressful. And, start to say, okay, someone's going to have a baby, let's find out what the symptoms are that we know, hey, we need to probably talk to a doctor, a mental health professional to make sure they're safe, right? Then and have resources as well. A lot of times you think, well, we always have babies, nothing will happen. But we have to start realizing that mental health is so real. I think also on the individual level, part of taking care of yourself during pregnancy and after is having these kinds of resources and knowing that it is possible that you could have your life could change so drastically in ways that you didn't even expect. And so you have those resources at hand as well, and then again, also on this level, raising of awareness of what these symptoms look like, of when that it's really time to say something, talk to somebody, ask somebody for help, right? And yeah.
Ms. McFarlane, in the little time that we have available, I think it's important that we try to contextualize this situation, because it's a real tragedy. We've had similar type, different manifestations. Remember the young woman who abandoned a newborn baby in San Fernando General Hospital a few weeks ago. We've had situations across many years where there have been very tragic and traumatic murder-suicides where the entire family has been wiped out because for some reason the economic circumstances have changed and a level of desperation takes hold. And therefore, do we even take the time to contemplate what could be the state of mind of an individual? Because as I was discussing earlier in the first hour, you and me sitting down having a cup of coffee in a comfortable life, relatively comfortable, having breakfast or to chatting with friends is not the same as someone who might be thinking, where the next dollar coming from? How am I going to mind this child? Where am I going? I can't see my way out. Maybe, as you said, there might be intellectual deficiencies. So therefore, the circuitry that would allow us to make so-called rational decisions may not apply to another individual.
Absolutely correct. And you hit the nail on the head. Sure, there could be something intellectual happening that affects the cognitions and the way that we think and we rationalize and we make good decisions. Stress could also very much interfere with the way that we make good sound decisions. Life circumstances, education, even experiences growing up. And we spoke about parenting some time ago and the fact that it's not do as I say, it's really do as I do. And the things that we observe, the way that we observe our primary caregivers and the people who are the most influence on us growing up, solving problems and managing conflict and managing stress is what we end up doing mostly during adulthood, unless we really have the insight to say, hey, maybe I can do things a little differently. But that usually happens after, you start to realize this is not working. But then again, some people don't come to the point where they realize this is working. So I guess this is where, the people that we do interact with, as you're mentioning, can hold us accountable and say, hey, I recognize this, I noticed that, and we have those kinds of conversations and we actually do something about it.
And before we conclude, and we thank you very much again for making yourself available to have our discussion this morning. Before we conclude, what would you say to anyone who might be going through a period of real stress, who may be feeling overwhelmed, whether it's about their family situation, whether it's about a newborn, whether it's about their economic circumstances, whether they're basically almost going down a pit of despair over their circumstances as a parent or otherwise? Just as a final point, what would you like to say to them?
Know that there is help available. There are free services and there are paid services. Make sure that the help that you get is from a reputable, duly qualified professional. And don't be afraid to seek the help that is necessary. And you look at your life and you say, hey, doing might have been working, as I mentioned a couple minutes ago, and this is time. It is time to get the help so that I keep myself safe and the people I care about safe as well. Also, if you do have people in your life that are willing to support you, reach out to them, right? Get the necessary information about resources and symptoms and figure out if what you're feeling is within normal limits or if it is time to talk to someone. And again, just don't be afraid to seek help. People are here waiting and happy to help you.
Clinical psychologist Kelly McFarlane, we thank you very much indeed for taking the time to be with us this morning.
Sure.
It really is a very tragic situation that unfolded yesterday, as we all found out, as a nation. But again, there are broader issues that maybe we don't spend enough time discussing or indeed working on as far as the mental health of the nation. 7:09 in Trinidad and Tobago. We are in the second hour of Morning Edition. Our focus comes back to Patriotic Month and our collaboration with NALIS, the National Library, when we come back.